So I am Stephen Price. I am the Clinical Professor of Neurosurgical Oncology, and I'm an Honorary Consultant Neurosurgeon in Cambridge with a special interest in surgery for patients with brain tumours. And I'm based within the Department of Clinical Neurosciences in Cambridge. So my interest is trying to improve how we deliver surgery for patients with brain tumours, in particular how we can individualise that treatment for individual patients. And we're doing this through a number of ways. One way is trying to work out what we should be taking out in patients, and an individual patient knowing what our target should be. We're also trying to understand the impact surgery has on the normal brain, and gives us an idea of really what we can't touch. What are the areas we will cause problems if we do try to remove that area of the tumour? And then the rest of it is around trying to select the right patients. What is the best treatment for an individual patient? And also the whole thing around rehabilitation. So after you've had surgery, patients are always a bit worse. How can we improve their outcome, improve their functioning before they start oncological treatment? And in fact, we're also now looking at prehabilitation, which is what can we do to patients before they get to surgery to improve their fitness before we do an operation. So the Brain Tumour Imaging Laboratory aims to take advanced imaging methods, so MR methods and also some degree PET imaging as well, and bring these into the clinic. And our main aim is really to identify potential uses for these, and so they can tell us a bit more about the pathology of what's going on in tumours, but also to do the studies that show the utility of them. One of the problems with a lot of the imaging studies is that they tell us a lot of information about what's happening with a tumour, for example. They tell us a lot of nice information about what's going on with the tumour, but they never get into clinical practice because they don't change practice. And what we're trying to do is develop things that show that if you use these methods, it will help change practice. And the two big areas we're looking at is how far the tumour spreads into the normal brain, but also looking at normal brain function as well and trying to understand that as well. We've sort of come to a bit of an impasse in that we've tried various methods, and they've all sort of haven't really gone anywhere, haven't really helped us very much. Surgery, I think there's still a big possibility of surgery, and the discussion now within the surgical field is about what's called supramaximal resection. So not only taking out what you can see as the obvious tumour on the scan, but going a bit beyond that. And we're trying to develop methods that will allow us to see what those areas are to help improve outcomes. Our feeling is that you have to think about treatment for brain tumours in two groups of people, really. You've got to think about, obviously, we always want to have the great new technique or the new treatment that's going to work for patients in the future, and developing up from very early stages from sort of animal models and bringing it through. But we still see on a regular basis patients every week in clinic that have brain tumours that we need to have something for them now. And so a lot of what we're doing at the moment is thinking about the patient of today and what we can do for that patient of today. I think there is some, the main way I think we're going to improve that is by looking at each of the elements we're doing and seeing how we can improve them a little bit. This idea of aggregation of minimal gains. Can we make surgery a bit better? Can we make radiotherapy a bit better? Can we start using targeted therapies and understanding which patients we should use these therapies on? I think is what we're going to see the differences for these patients. So the idea of the Brain Cancer Virtual Institute is to get researchers across the whole of the Cambridge and even beyond for the east of England to think about how they can improve patient care and research for current and future patients. And it has managed to do that by linking with people in departments you wouldn't normally expect to be involved with this. So we have links to 4 of the 6 schools of the University of Cambridge. We have links from numerous departments, from engineering and chemistry through to the ones you might expect for things like the Cancer Institute, where you'd expect there to be some interest in these areas. And the idea is to get new ideas from these other areas, and get people together to talk about these ideas and focus them on the patient and how we might improve things in the future.